these much-needed screening procedures will also necessitate fully staffed, prepared quarantine stations wherever people are entering the country.
Welcome back to State of Texas In Depth. Federal officials will start taking the temperatures of people traveling to the United States from Western Africa to contain an Ebola outbreak. But is that enough? Weighing in on this week's topic, we have Phil Huang, a doctor, medical director of Travis County, also with the Infectious Disease Committee on Texas Medical Association. And we've got Jay Root from our media partner at the Texas Tribune. Welcome to both of you.
Thank you. Thanks.
So, we just heard Governor Perry talking about the need for more screening. We've heard about it at other bigger airports away from Texas. Are we ever going to see something like that here in Austin?
You know, I mean, what they're trying to do is add one more layer of protection to the protections that are in place. I think they chose the 5 airports because I believe about 94% of those that are traveling from the affected countries come through those airports. So I think it's, again, getting a greater yield with that.
Jay, I know we'd had discussions about the TSA anti-groping idea. You know, is this an invasion of privacy? Back then, what was it, 2 years ago in the session? Do you feel like that this could be a sticking point for some people, also a privacy concern, taking people's temperature at the airport?
I sort of doubt it. I think that, I mean, it's certainly possible. I can't predict the future, but people are really concerned about this. This scare has broken through to a lot more people than know that there's an election in November. I can tell you that. I'm hearing from neighbors are asking me, everybody's concerned about this, whether it's warranted or not. So I think people are willing to put up with that.
You've been covering the story this week. Governor Perry, it's just giving him something real time that he can really be out there and talking about a crisis that's happening right now. You know, is this giving him any clout for a possible presidential run?
I think it does give him an opportunity to get in front of a huge bank of cameras. That's clear. I was at the press conference in Dallas right after the diagnosis of the patient who has unfortunately died. But there's also a risk, as that press conference demonstrated, because he came out and said, we got this, it's under control, and then it was in that same very press conference a couple minutes later that the doctor came forward and said that they had made a pretty big error. And so I think a lot of people think the initial response to let this guy go was botched. So, you know, Perry, and he's going to Europe this weekend, so if there's more problems, it could be a problem for him.
Obviously, all states are kind of watching what Texas does right now because this was the first diagnosis in the nation. Do you feel like Texas is handling itself appropriately when it comes to the efforts doctors are making?
Sure, I do think we are prepared. I mean, this is for public health. This is part of the core functions that we do all the time. Whether we deal with infectious diseases every day, we follow up on case contacts and following up on those cases and treating people appropriately, working with hospitals on infection control practices, working with our EMS, other partners in this. So I think, you know, I think that what we're hoping for is increased vigilance for this, and that's what in working with physicians and hospitals, that they have that heightened awareness when someone comes in with a fever or symptoms compatible with Ebola, to ask that travel history if they've been to one of these affected countries in the last 21 days.
We haven't heard a lot of specifics yet about this task force that Governor Perry has talked about. We know who's on it and that it's going to happen and they're going to be doing things, but what do you think is going to come out of that first?
You know, I mean, with all of this, a lot of it is coordination, and that's where, in terms of our preparedness, we do have a lot of coordination in place. We've had experience with H1N1, with West Nile virus, with other situations, and so it's that sort of communication between the state level, the federal level, down to the local level. And so I think that task force will probably work on some of those systems, work on looking at our systems and procedures, that they're all in place and that it's uniform across the state.
This task force came together really quick, and I couldn't help but notice that several of the people on there are, you know, have close acquaintance with the governor and also are from his alma mater, A&M. Is it just a coincidence?
Well, look, the governor loves Aggies. He is an Aggie. That was probably not a huge surprise. I did see there was at least one UT guy on there. But I think this task force was sort of a recognition that the initial response that there were some questions. There were also some questions about decontaminating that apartment, that they didn't have the procedures in place to do that, and also that local health departments are really sort of the first line of response here, and how to coordinate among those health departments. There were a lot of questions at the committee, the Senate committee that looked at this. So I think the legislature has a lot of questions, and I think that they're going to take infectious disease response preparedness very, very seriously in the next session of the legislature.
Dr. Wong, I'm going to give you the last word. You deal with people calling into Travis County all the time. You know, what do you want to tell these people that might be worried that Ebola symptoms are showing up in their family? Because obviously it's something that's on the mind of many people right now.
I mean, first of all, it is very unlikely that we will have a case in our community, but we want to be prepared, and we're doing everything we can to be prepared. You know, as long as there's this continuing infection and outbreak in West Africa, we can't get the risk down to zero. But we're doing everything we can to bring that risk down as low as possible. And you know, this isn't West Africa. We have very capable hospital systems, physicians, infection control processes, and so it's not going to be like that. And this is what we do in public health, core function, and we can control this.
Gentlemen, thank you for being with us. I appreciate it.
Thanks.
All right, you can see our complete coverage of Ebola in Texas online right now at KXAN.com. We appreciate you joining us for State of Texas In Depth. Be sure to join us every Sunday morning at 8:30. Meet the Press with Chuck Todd is coming up next.